Hello everyone, my name is Amit Kumar Singh, working as Assistant Professor in Acharya's NR Institute of Physiotherapy. Today I am going to explain you about joint kinematics of knee complex. This is our part 2. In part 1, I have explained about introduction of knee complex, meniscus, ligaments of knee joint, patellar plica, bursa, joint capsules, and movement of the synovial fluid. So if you have missed the part 1, I will be going to put the link in description box of part 1 where you can go and read about part 1 of knee complex. So let us start with part 2, joint kinematics. Joint kinematics, also known as mobility. Mobility means movement of the bone. Joint kinematics. Now here the kinematics word means movement. One more term is there which is known as kinetics, means study about forces. When the term is kinematics means study about movement, and kinetics means study about forces. Now here first movement is our flexion and extension. Before going to this flexion and extension, just we will have a quick look of the types of kinematics. As I told you, kinematics means study about the movement. This we can divide into two parts, that is our osteokinematics and arthrokinematics. As the name suggests, osteokinematics means movement of the bone. Arthrokinematics means movement of the joint surface. As the term arthrokinematics, arthro means joint surface and kinematics means movement. So in this we will discuss about movement of joint surface, which again include three types, that is roll, spin and slide or glide. Similarly, osteokinematics means osteo, bone, and kinematics, movement of the bone. So in this osteokinematics, we have to include flexion, extension, adduction, abduction, medial, lateral, rotation. So these terms comes under osteokinematics, and arthrokinematics is related with rolling, sliding, gliding, spin movements of the joint surface. Now let's start with flexion extension. So range of motion for flexion is somewhere around 0 to 130 to 140 degree, means in between 130 to 140 from 0. Extension is in the range of somewhere from 130 140 to 0 degree. Hyperextension is 5 degree normally. If it is more than 5 degree, the condition will be known as genu recurvatum. Now before going to the arthrokinematics of knee complex, let us discuss about convex concave rule. This is very important if you are going to read about the osteokinematics and arthrokinematics of each and every joint, then you should be clear with what is convex concave rule. Okay, so now as the name suggests, convex means here the joint surface is going to be the shape of the joint surface will be convex, and concave, the surface or joint surface of the bone will be concave. Now let me show you. If you see the diagram here in this A diagram, this surface looks like concave. Concave means a rounded inward direction, means the round shape will be in inward direction, the curve will be there. Okay, and the convex means the rounded direction is on outward side, the rounded part is in outward side. So here you can see this is convex and this is our concave. Okay, so I hope this is clear, which is known as convex and which is known as concave. If you do one thing, if you make a fist in the hand, if you make a fist, that whole surface will look like a convex, and if you keep your palm like a cup shape, that whole curve will be representing you concave shape. Now let's start with what is convex concave rule. Now to learn convex concave rule, it is divided into two parts. First, when the moving surface is convex, and fixed surface is concave. Now let us see this example number A. Now here consider this is our tibia bone. Okay, this tibia bone is fixed, it is a weight bearing position, the tibia is fixed. The moving bone is our femur. Consider this as Femur. This is our femur bone. So moving is femur. Now, when the femur is going to move on the tibia, it means femur lower condyles are which shape? They are convex in shape, okay? And the tibial condyles upper part, they are in concave in shape. So, whenever, remember, convex moves on concave, here the movement is going to be done is flexion movement, okay? The movement is going to be flexion. The person is in standing position and from here he is going to do the squats or going to sit on a chair. So the movement will be flexion. Now when this movement is going to take place, remember, whenever convex surface is moving on concave surface, the roll and slide is always in opposite direction. So the angular movement of the bone and the roll is in same direction and the slide is in opposite direction. Same. Now consider the next example here. Now here the moving surface is concave. If you see here, this is the concave surface now, and the lower part, this one, is our now convex. So now here the moving surface is concave. So concave is going to move on what? Convex. Okay. Now whenever this will take place, it suggests whenever a concave moves on convex, the roll and slide both are in same direction. The roll and slide both are in same direction of the angular movement. One thing you need to keep in mind that with whichever direction is the angular movement, whichever direction is the angular movement of the bone, how it depends with the roll. Means roll and angular movement will be in same direction. This is the roll you can see here, and this is the angular movement of the bone. Both are in same direction. If whatever surface is there, it means if the moving surface is whether convex or if the moving surface is concave, the roll and angular movement of the bone will be in same direction. But if the moving surface is convex on concave, slide is in opposite direction. And if concave is the moving surface, then it is in same direction. But here you need to keep in mind, whatever the surface of the bone is moving, the roll and the angular movement is always in the same direction. Now coming to the arthrokinematics. Now here the flexion and extension axis is the horizontal line passing through the femoral epicondyles. For example, if this is our femur, so this will be the line which is passing through the femoral condyle. So this is our axis, horizontal line passing through the femoral epicondyles, that is known as transepicondylar axis. And around this axis we will be getting the movement, that is flexion and extension. Now let us see the example what is going to happen. First point, femur is going to flex on fixed tibia. So two things are here. Which bone is going to move? Femur, and it is going to move on the fixed tibia. See here example. This is the tibia bone, both the side, A and B diagram. We will discuss one by one. So this tibia is fixed. The moving bone is femur. This up part bone is femur. This is the moving bone. So when this dark line is our initial position and the dotted line is our final position. So you can see here the person is in standing position because tibia is fixed. Okay. So the person is going to do from extension to flexion. It should bend. So it is going in bending direction. So when there is a flexion of the knee joint, what happens? There is a posterior roll. There is a posterior roll. And whenever there is a flexion of the knee joint with posterior roll, always we will get anterior glide. Why? Already I have previously explained you about convex concave rule. When a convex surface is moving on concave, the roll and slide is in opposite direction. Similarly, when we are coming from flexion to extension movement, then again the roll will be in anterior direction because the angular movement of bone is in this direction. So obviously roll will be also in anterior direction, and when roll is in anterior direction, the glide will be in posterior direction. This you can remember how. See, you need to check the direction of the bone, in which direction bone is moving. But you need to keep in mind whether the surface moving is convex or concave. If the moving surface is convex, if you see, when we are doing flexion, bone is going backside, means posterior. So roll also will be posterior. Obviously, then glide should be in opposite direction. So opposite of posterior is anterior. So glide will be anterior. And when we are doing extension movement, bone is coming in which direction? Anterior direction. Means this all things are like, this first diagram is representing when we are going for squats. This is from coming back from squats to the standing position. So our femur is coming in anterior direction. So when anterior is coming in femur is coming in anterior direction, the roll will be anterior roll. And now what you can remember, now glide should be opposite, so it should be posterior glide. So this is how the arthrokinematics takes place for femur flexing on fixed tibia. Now when tibia is going to flex on the fixed femur, now how does it take place? Just look at the rough diagram. For example, this is our femur bone roughly, and here we are having the tibia bone. Now what is going to happen? Now this is our 90-degree position, means sitting position, non-weight bearing position. The person is sitting in high sitting position. So from here the person is going to do the extension or flexion movement. Okay, so the tibia bone is going to move. This is our tibia and this is our femur bone. So tibia is going to move here. Now whenever tibial condyles, now here what will happen when tibia is moving on fixed femur, then roll and glide will be in posterior direction. See here, the tibia is going in flexion movement in this direction, means the angular movement of bone, if you see, this is also going in which direction? In posterior direction. Obviously, then roll will be in posterior direction. Now you need to remember how glide will go in which direction. So now which surface is moving? Now concave is moving on convex. So whenever concave moves on convex, both roll and glide always goes in same direction. So if roll is going in posterior direction, the glide will also go in posterior direction. Similarly, it will happen in extension. When the movement is extension, if this is same again our femur and tibia, the movement is going in this direction. When the movement is in anterior direction, see, the angular movement of the bone is in anterior direction. So obviously the roll will be in anterior direction. And again we know the moving surface is what? Concave. Means tibia is concave. So it means roll and glide both should be in the anterior direction. Now let us discuss what are the role of ACL, PCL, meniscus and muscles when we are doing flexion or extension movement. Means now already we have discussed about concave convex rule. Okay, when we are doing flexion movement or when we are doing extension, which side is the roll and which side is the glide? Okay, or which side is the slide? So when we are doing flexion movement, the angular movement of the bone is in posterior direction. So it means the roll is in posterior direction and the glide is in anterior direction. Why? Because the moving surface is convex. And when moving surface is concave, that is our tibia, and when we are doing that time flexion movement, what is happening? Angular movement of bone is in posterior direction. Okay, so when it is in posterior direction, the roll also will be in posterior direction and glide also will be in posterior direction because the moving surface is concave. So whenever concave moves on convex, we will get roll and slide in same direction. And whenever convex moves on concave, we will get in opposite direction, roll and slide. So now here in flexion of the femur, we know there is a posterior roll. The femoral condyle, when there is a posterior roll, this femoral condyle creates a tension in the ACL ligament. Due to that, we are getting anterior translation movement of the femoral condyles. So see what is happening? The bone is going in posterior direction. Okay, so the condyles How they are coming anterior glide means roll is in posterior direction and glide is in anterior direction. This already we have seen through arthrokinematics. But there are some structures which are helping for this movement. They are ACL, then we will have PCL during extension, we will have meniscus, we will have muscles. So now as we know, ACL is attached here, anterior cruciate ligament. So it goes from anterior to posterior direction, anterior of the tibia to posterior of the femur. So when we do flexion, there will be a tension in this ACL ligament and it will try to pull the femoral condyles in anterior direction. Now same, what will happen when we are doing the extension movement? Now the angular movement of bone is in anterior direction. It means the roll is anterior rolling. Okay. And we have a ligament which is named as PCL, posterior cruciate ligament, which is present here. Okay. Now what will happen when we are doing extension movement? We know there is a glide, posterior glide. So this is due to the tension generated in the PCL ligament, which tries to pull the femoral condyle in posterior direction. Now, what is the role of meniscus? This is also very important. How it is going to take place? Let us see first diagram. Now, if we see here, this upper part, this is our femur bone, and this we have meniscus. This meniscus is a wedge shape. Already we have discussed. This is a wedge shaped bone, meniscus, the structure. Okay, now here we are having the lower part of the femoral condyle. In this image also you can see here, this is our meniscus, lateral meniscus. Why lateral? Because fibula is present on this side, and this will be our medial meniscus. This is our articular cartilage, patella, femur and tibia. Okay, now whenever the femur is moving on tibia, in between we have a meniscus which is important to reduce the friction. It also plays an important role to provide slides in anterior or posterior direction. So when we are doing flexion movement, what happens? There are two types of shear forces which are going to be generated. One is meniscus on femur. MF means meniscus on femur, means meniscus is trying to push the femur, that is meniscus on femur. Another is femur on meniscus, means femur is trying to give pressure on meniscus. So first one, when meniscus on femur is there, we will get two components, that is one is vertical component and one is shear component. Okay, and when femur is going to give pressure on meniscus, again two components will be there, that is our shear component and vertical downward component. Now let us see how it happens. So similarly, as we know, the oblique contact of the femur with the wedge-shaped meniscus result in the forces, two forces. Already I told which forces are that? Meniscus on femur and femur on meniscus. So we can resolve them into two components, that is vertical and shear component. Now shear 1 what will do? Shear 1 assists the femur in its forward glide during flexion. As we all know, when flexion is taking place, the roll is in posterior direction and glide is in anterior direction, that is forward. Okay, so here which force is going to help? Shear 1 force is going to help to again provide this forward anterior glide. There what was happening in previous slide, ACL was supporting to produce anterior glide and PCL was supporting to produce posterior glide. Now this shear 2 force is going to assist to pull the meniscus in backward posterior direction. Okay, now why in posterior direction, that we will see later, but the shear 2 force function is to pull the meniscus in posterior direction, and shear 1 will do what? It will try to pull the femur in forward glide during flexion. Now same with the diagram, if you see the resolution of forces of meniscus on femur, this is the shear 1 which is trying to produce the anterior glide when we are doing the flexion movement, and this is the femur on meniscus shear 2 force which is trying to pull the meniscus in posterior direction when we are doing the flexion movement. And this we will read again in detail how the muscles attached on the posterior side also try to pull the meniscus in posterior direction while doing the flexion movement. So same, now muscles role. Now here you can see here we are having this muscle attachment, that is our semi-membranous muscle, and the medial meniscus is having a contact with attachment with semi-membranous muscle. So when we are trying to do the flexion movement, this semi-membranous muscle try to pull this meniscus in posterior direction. So now why it is important? Okay, when the meniscus is pulled in posterior direction, what will happen? As we know, the femur, due to this femur shear one force, the femur is going in anterior glide. Now, when this meniscus is coming in back direction, this, why it is coming? To be below the femoral condyles, to be below the femoral condyle. If this meniscus will not come in posterior direction and it remains still here only to its neutral position, and still we are doing the movement, what will happen? The femoral condyle can come in direct contact with the tibia, and that time friction will be more. So to reduce the friction, the meniscus has to follow the direction of the angular movement of the femoral bone. So as we know, roll is in posterior direction. So meniscus is also supposed to travel in posterior direction to just be below the femoral condyle to reduce the friction. Okay, and there is one more muscle, that is popliteus, which assists for the lateral meniscus. Here is the semi-membranous muscle which is assisting for the medial meniscus during flexion. Now coming to the next movement, that is our medial and lateral rotation. Now this range of motion is at 90 degree, means at 90 degree of knee flexion only it is possible to observe the medial and lateral rotation. So at 90 degree of knee flexion, when the person is in high sitting position like this on the stool or chair in high sitting, means the foot should not come in contact with the ground. So you can see here, from here it is easy to go for medial and lateral rotation movement. Okay, so lateral rotation is 0 to 20 and medial is 0 to 15 degree, and the axis is longitudinal axis. Now keep in mind, important, this axis is longitudinal and it is passing through medial tibial intercondylar tubercle. Now if you consider here, this is our tibia bone, okay, and this is our femur. Let us take another diagram. This is our tibia and here we will have femur. Okay, so the axis passes from like this, from top to bottom, around which the movement rotation can take place easily, and this axis is passing through medial tibial intercondylar tubercle. Now see this image, this is the greater toe, so obviously this is our medial side and this is our lateral side, and this medial part, medial condyle, is going to act as a pivot. Already I told why, because the axis is passing through here, axis is passing through the medial side. Okay, so this is going to act as a pivot around which the movement will take place. So consequently the medial condyle act as a pivot point, while the lateral condyle move through a greater arc of motion regardless the direction of the rotation. So what does it mean? Whenever we are going to do medial and lateral rotation, so now if this is the medial side, this is the medial rotation and this will be our lateral rotation. So whenever we do medial rotation or lateral rotation, the medial condyle of tibia will move in shorter arc. Okay, it will move very slightly, but our lateral condyle will move in greater arc of motion. Okay, this is we need to keep this we need to remember. Now how this movement is taking place, let us discuss one by one. As the tibia laterally rotate on the femur, the medial tibial condyle moves only slight anterior on the relatively fixed medial femoral condyle. Now what does it says? Again, this is our medial side, greater toe is there, and this is our lateral side. Okay, this is the same, this will be our medial tibial condyle and lateral tibial condyle. This is our pivot joint axis. Okay. Now, when tibia is going where? In lateral rotation. Lateral rotation means the movement will be in this direction. Okay. The movement is in this direction. So now what will happen? The medial femoral condyle will move anteriorly. See, this medial condyle has to move anterior, then only it is possible to go in lateral rotation. Okay, then only it will go in lateral rotation. So during this time what happens? The medial tibial condyles moves in very slight anteriorly. It will move slight anteriorly. Okay, on the medial femoral condyle. Top we will be having medial because it is moving in between femur and tibia. So it is moving on a fixed medial femoral condyle. Whereas the lateral condyles move a larger distance posteriorly on the fixed lateral femoral condyle. But as we know already in the previous slide we have seen, if tibia will move, medial condyle of tibia will move slightly, whether it is anterior or posterior, but lateral condyle of tibia will move in a greater amount. Okay, so when we are doing lateral rotation, our medial condyle of tibia is moving very slightly in anterior direction, and as we know this is the lateral direction movement, so lateral condyle of tibia has to move posteriorly but with a larger distance. So this is how the arthrokinematics takes place. Now during medial rotation means again this is medial side, this is lateral side, means the arrow movement will be this one. This is our medial rotation. Now I think you can tell yourself what will happen. As we know this is the pivot joint, and we know one more thing, whatever the direction of movement is there, medial condyle of tibia will move very slightly, whether it is anterior or posterior, but lateral condyles of tibia will move in greater arc. Okay, as now we are doing the medial rotation, so medial condyle will go in posterior direction but very slightly, and lateral condyle of tibia will come in anterior direction but with greater amount. So same thing is written, during tibial medial rotation, the medial tibial condyle moves slightly but in posterior direction, whereas lateral condyle moves anteriorly through a larger arc of motion. Now one important thing, during both medial and lateral rotation, the knee joint meniscus will move in the direction of the movement of corresponding femoral condyle to maintain their relationship with the femoral condyle as they did in flexion and extension. Now what does it mean? See, already I have explained you during flexion and extension, when we were doing flexion movement, okay, if this was our tibia bone and this was our femur and it was going in flexion movement, the meniscus was also going posteriorly in the angular movement of bone direction to just come below the femoral condyle to reduce the friction between femur and tibia. If it doesn't come in the posterior direction, the femoral condyle will come in contact with the tibia and there will be more amount of friction. So similarly here, when we are doing medial and lateral rotation, the meniscus is supposed to move in the direction where the femoral condyles are moving, not in the direction where the tibial condyles are moving. For example, if we are doing tibial medial rotation, okay, so tibial medial condyle is going posteriorly and tibial lateral condyle is going anteriorly. So meniscus will not move with this direction of tibia, it will go with the direction of femur. So how it goes, we will see. Now listen carefully, tibia when it is going for medial rotation, okay, tibia is going for medial rotation, that time femur goes for lateral rotation on tibia. So during this time what will happen, the medial meniscus will come anteriorly on tibial condyle to remain beneath the anterior moving medial femoral condyle, and lateral meniscus will come posteriorly to remain beneath the posterior moving lateral femoral condyle. Okay, here the tibia is going medially. So when tibia is going medially, femur, just two things you keep in mind, I will explain in detail. tibia is going in which direction? Medial direction. Okay, if this is a tibia bone, it is moving in medial direction. Upside we will have a femur. That femur will go in ulta direction, that is in lateral rotation. Now let's see that example here in this diagram. So this is our tibia, okay, medial side, lateral side. Consider upside of this image. This is the superior view of the image. Upside we are having the femoral condyles. Okay, here this is consider medial condyle of femur and this is lateral condyle of femur. Now what is happening here? The tibia is moving in which direction? In medial direction. We are discussing about meniscus movement. Okay, so tibia is going in medial direction. So if tibia goes in medial direction, the femoral condyle comes in lateral rotation. Okay, tibia is going in medial rotation, femoral condyle comes in lateral rotation. So when femoral condyle is coming in lateral rotation, it means the medial condyle, this medial condyle of femur is moving anteriorly and this lateral condyle of femur is moving posteriorly. So meniscus is supposed to come in this direction of movement, means in which direction the condyles of femur are moving, in that same direction meniscus are also supposed to move. So when medial rotation of tibia is taking place, femur is going for lateral rotation, and during this lateral rotation the medial condyle of femur is going in anterior direction. So medial meniscus will move in anterior direction and lateral condyle of femur is going in posterior direction. So lateral meniscus is also supposed to go in posterior direction. So this is the same thing what they have explained. When tibia goes for medial rotation, femur goes for lateral rotation. So medial meniscus will go anteriorly on tibial condyle and it will be just below the medial femoral condyle to reduce the friction. And our lateral meniscus will go where? Posteriorly to just be below the lateral femoral condyle. So this is the way meniscus continue to reduce the friction and distribute the forces without restricting the motion of the femur. Now keep a note point why this medial and lateral rotation and the meniscus should be moving with the femoral condyle. To maintain the relation with the condyles. Second, to decrease the friction and distribute the forces evenly. Next, rotation is minimum or almost zero at full extension. Already I have told you, we will be getting the medial and lateral rotation only around at 90 degree of knee flexion. Why at extension it is zero or minimum? Because that time the ligaments are maximally taut. Now coming to the last movement, that is our valgus and varus, that is known as abduction and adduction movement. Now here the range of motion at full extension, when the knee is in extension, the range of motion is only around 2 degree. When the knee goes in flexion, the range of motion of adduction abduction comes around 13 to 20 degree. And the axis for this adduction abduction is sagittal axis. And one note point, these movements are minimal but exist to contribute to normal functioning. As by naked eye these movements are not visible and these are minimal, but these are very important also to contribute the normal functioning of flexion and extension. This we will discuss, which is known as coupled motion, in the coming part, that is part 3. So stay tuned for my part 3 where I will be explaining about the coupled motion, also known as screw home mechanism or locking and unlocking of knee joint. Hope you have liked my video, so please do like, share and subscribe. Thank you for listening.